Hi friends, welcome to FastCoder 21 free medical coding YouTube channel. Always my intention is to share knowledge and gain knowledge. So if I share knowledge, I will get the knowledge. If you are visiting for the first time, please click on subscribe button to receive future updates about medical coding. So today we are going to learn tips to code periprosthetic fractures using ICD-10 CM. So coding periprosthetic fractures is one of the most complex and confusing topic in ICD-10 CM. So in this today's session, we are going to learn what is a fracture, how do you differentiate normal fracture versus periprosthetic fracture, and how to sequence the codes whenever you code periprosthetic fractures. So before going to code these periprosthetic fractures, we need to understand basically what is a fracture. So based on technical knowledge or medical term, so fracture is a break in the bone. So wherever you see the break in the bone, you can consider it as a fracture. So in ICD-10 CM, we are having multiple types of fractures: open fracture, closed fracture, displaced fracture, non-displaced fractures, spiral fractures, and so on. These are based on the location of the fracture. So now we need to understand types of fractures based on occurrence. So based on occurrence means what is the underlying cause of the fracture. So based on occurrence, we are having three types of fractures. First one is most common one is traumatic fracture. Next one stress fracture. Next one pathologic fracture. So now we will learn each one by one clearly. So first we will learn about traumatic fracture. So what is a traumatic fracture? The fracture which occurs due to trauma, usually call it as traumatic fracture. If you are a medical coder or trying to enter medical coding, most of the time in operative reports or operative charts, you will see traumatic fracture. So in US, most of the fractures are traumatic fractures. So traumatic fracture is a fracture which will occurs due to trauma. Next one, we will learn about stress fracture. So stress fracture is the fracture which occurs due to stress. So if the patient performs repetitive stress tasks continuously, patients will get stress fractures. So next one is pathologic fracture. So most of the time, in order to code or in order to understand pathologic fracture, in the documentation we need to check any type of neoplasms or osteoporosis. So most of the time, these pathologic fractures occurs due to underlying cause, most commonly neoplasms as well as the osteoporosis. So now we will learn what is a periprosthetic fracture. So basically periprosthetic fracture is a fracture usually which occurs near to the prosthetic joint. So wherever you see prosthetic, so here you need to remember that patient is having the replacement. Like patient may having, for example, patient is having the hip replacement. So most of the time patients will get this prosthesis due to replacements. So periprosthetic fractures are the fractures which will occur near or around the prosthetic joint. So basically periprosthetic fractures are not traumatic fracture. These will occur due to stress. So periprosthetic fractures are not a complication of the prosthetic implant. Most of the time these periprosthetic fractures occurs due to trauma as well as pathologic condition. So anyway you don't need to worry. We are going to see few example scenarios related to coding prosthetic fractures. So as the name itself consists of periprosthetic. So here peri means around or near to the prosthetic implant. So these periprosthetic fractures are not related to the bone itself. So whenever you see the documentation periprosthetic fracture, we can't code it as complication of a prosthetic device. So now we will learn how to code periprosthetic fractures using ICD-10 CM. So in ICD-10 CM, M97 series usually we will use for periprosthetic fractures. So under M97, if you see instruction note, they will provided like if you know the cause of the periprosthetic fracture, you need to code that cause separately along with periprosthetic fracture like traumatic or pathologic fracture. So if you see here, this is the M97 series. Okay. So if you see here, code first if known the specific type and cause of the fracture such as traumatic or pathological. So before coding M97, we need to use the reason for the fracture, whether it is traumatic or pathologic, based on the ICD-10 CM guidelines, which they have mentioned here. Code first. That is also, if we know the reason for that fracture, we need to code the fracture first, then M97 series code. So here we need to use, in order to code periprosthetic fracture, two codes. One is for M97 series, which denotes periprosthetic fracture, and one code for underlying cause of the periprosthetic fracture. So total here we need to use two codes. One is for periprosthetic fracture M97 series, and next one is for the reason for the periprosthetic fracture, which is, if it is trauma, we need to code S codes, and if it is osteoporosis, we need to code M codes. So now we will see few example scenarios related to periprosthetic fracture. So example scenario 1. So patient is status post left shoulder replacement and presents for periprosthetic fracture of the humerus after rolling over in. So the patient was worked up and it was found that the fracture was due to underlying osteoporosis. There was no fracture of the actual joint processes. So here, based on the documentation, patient is having the fracture in the around the joint or prosthetic implant, not related to the implant itself. So as the fracture is surrounded or around the prosthetic implant, we will not code it as complication of the implant. We need to code it as prosthetic fracture. So here there is no fracture of the prosthetic implant. Basically this is surrounding the prosthetic implant itself, not related to the prosthetic implant. So here we need to assign M84.422, which is for pathologic fracture left humerus initial encounter for fracture as the principal or first listed diagnosis, followed by M97.32 into A. So as secondary diagnosis, as well as we need to code for osteoporosis also. So here patient came in for fracture. So after the workup, physician has found that patient's fracture is due to osteoporosis, not due to any type of implant. So as per based on guidelines, we need to code reason for the prosthetic fracture first, then we need to code prosthetic fracture itself, and also we need to code reason for that prosthetic fracture, like underlying code, which is osteoporosis code. So in this scenario, total we need to code three codes. First one is for pathologic fracture. As we have discussed previously, if the patient is having any type of fracture due to osteoporosis or neoplasms, we need to code that as the first listed code or principal diagnosis, as well as followed by the periprosthetic fracture around internal prosthetic left shoulder joint initial encounter. So this is the second guideline. After that, we need to code M97 series is for periprosthetic fracture, as well as the reason for pathologic fracture is osteoporosis. So here we also need to code pathologic fracture, the reason for pathologic fracture, which is osteoporosis, and also we need to code osteoporosis. So total in this scenario, we need to code three codes. First one is for pathologic fracture left humerus, next one is for periprosthetic fracture shoulder joint. So next one is for osteoporosis code. So total three codes. So next we will see another scenario, example scenario 2. So patient is admitted for new periprosthetic fracture of the lower end of the left femur after falling down 5 steps. The fracture does not involve the actual joint processes. So here also, if you check the documentation, the patient clearly mentioned the fracture does not involve the actual joint processes. So here also we can't code it as complication of the joint processes, and more than that they have provided here. So here they are telling us that patient is having the fracture which is periprosthetic, so surrounding the implant, not related to the processes. So here also we need to code first S code for unspecified fracture of left end of left femur, as well as M97 series. So here we will code S72 series is for fracture of the lower end of left femur. So whenever we code periprosthetic fractures, we need to check exact location of the fracture. Whether physician is telling fracture is in the implant. If the fracture is in the implant, we will code complication. If the fracture is around the implant, we will code normal periprosthetic fracture. And also we need to check whether it is the bone fracture or periprosthetic fracture. Okay, thanks friends. So thanks for visiting FastCoder 21. Please like, comment, share and subscribe FastCoder 21 YouTube channel. If anyone looking for same day surgery coding, just send your mobile number to vincentmedicalcoder@gmail.com.